Dr. Satyajit, I want to ask what types of sports related injuries are more prevalent among general population?
So in my last 4 years of experience which I have had till now, I think most of the injuries which come to us are shoulder injuries, knee injuries and ankle injuries. These are very much common. The reason behind this is like shoulder and ankle, they are unstable joints.
Okay.
If you see, hip is a stable joint and stability is inversely proportional to mobility. If you can see, your hip is not that mobile, but your shoulder and your ankle as well as your knees, they are very mobile. So you have to compromise somewhere. So most of the injuries which we see are due to overuse or improper use. So what happens is people which present to us most probably are youngsters or maybe middle-aged people who just feel that they need to start working out. They don't warm up properly. So ACL injury is very much common. That is seen because people indulge into sports and they are not used to them. So what happens is, let us say take a person called Joe or someone like that. So Joe is a working professional, maybe say 35-year-old guy who's working 9 to 4 or 9 to 5 in his office. And one fine day his friends just call him up, hey, we have booked a turf, let's go and play football. So Joe used to play football in his school or maybe in his college days and he was okay at that. But after that he stopped working out, he did not do anything. And one fine day he just goes for football and comes back with a swollen knee. So what is the reason why this has happened? So Joe most probably had something called pivoting injury. So what is the anterior cruciate ligament? So anterior cruciate ligament is a ligament in your knee joint and the primary function of that ligament is to prevent the anterior translation of tibia. Like when you are walking, you have both the bones of like thigh, that is the femur, and the bones of the leg, that is primarily tibia. They move together in sync. They have to move together, right? But what happens is due to gravity and sometimes due to our different forces, the tibia translates anteriorly. That is, it moves forward compared to the femur. So the role of the ligament is to prevent that. So if the person indulges in activity which involve cutting movements, so there are some sports called as cutting sports. Cutting sports are like
pivot movement.
Exactly, pivoting movements. So that is American football, like no one plays here.
And people play kabaddi.
Yeah, kabaddi. And most likely is soccer or football. And people get injured because of that. And then what they come with is a swollen knee, or they could also have a meniscus tear, an ACL injury, and that takes a lot of time to heal. And that requires operative intervention sometimes, like if it is a complete tear. So this is what happens. If you just go into recreational sports, you are bound to get injured.
But I have heard that if you have some partial tear on your ACL or LCL or MCL, any tendon, it can recover on its own. It doesn't require a surgical prevention.
Yeah, so that depends on, like there are 2-3 things. So if you have an ACL injury or say for example any ligament injury, so we assess whether there are few clinical tests like Latchman's test or anterior drawer test which helps us determine whether the patient is affected or not. Then along with that we have to get the MRI done. So on the basis of the clinical examination as well as the MRI, we come to know whether the patient requires surgery or not. So sometimes the tear is not complete, tear is partial. So what we go for is a conservative management, that is we just give rest and followed by physiotherapy. But if the tear is complete and the patient is young, we should go for operative intervention.
Next question is how can people prevent injuries from happening?
So first of all, you should do proper warm-up. Once your muscles are warmed up, the joints are also stable. So warm-up is the most essential component to prevent injuries. And second is avoid ego lifting. Also, just because someone is saying that you can lift that much, if your body is not comfortable, you are not feeling comfortable that day, you are feeling okay, like I need to relax today, just relax. There is no point in just pushing yourself too hard for no reason. So this is the most important thing which I feel to prevent injuries. Proper warm up, no ego lifting, goal.
Do you think the weight training is the safest and best form of fitness training for the people who have never participated in any sports even in their early years, but all of a sudden when they are in their 30s they want to indulge in a lot of sports activity? Is weight training going to be necessary for them or not?
See, weight training is essential for everyone. So what happens is, this is same as the example I quoted before, like Joe. So if you like something, I think that is to be followed. Like if I like playing soccer, then yeah, I should go for that. If I have few friends who don't like gymming. Absolutely, they say ki, okay, I won't exercise or I'll play some sport, then fine, go for that. But if you have to choose something, okay, if you have to choose something, always go for the safest option available. Okay. So if you see sports stars like footballers playing, but you don't see the amount of strength training they do prior to their
That's the point.
Events. They are just not running on the field. Or if you are looking at maybe say cricketers, like they're jumping, diving, but the amount of effort they put in their strength training is amazing and massive. You should go for that. It's not like one fine day you just go and start playing. And what happens is detrimental things. I'll tell you what happens. You get injured in sports and then you never go back to sports. In fact, you never go back to any activities because you're scared first of all.
Whoa.
Okay, you get scared because of that, and then that doesn't help in the long run. So if you have to choose, and you are say you're a working professional, you're not an athlete. See, most of us, we have to accept we are not athletes. We have jobs, we have to, and we are into fitness just because we have to have a proper life, healthy life, long life, and you work properly because of that. It's not like you are working out 24/7 and then you're sleeping at your workplace. See, that is not done. The whole purpose of fitness is then defeated. For example, if you are a doctor like me and say I'm working out 24/7, in the morning hours I work out like crazy, like 2-3 hours in the gym, and then throughout the day I'm sleepy, I'm not able to perform my best in the operation theaters or maybe in my OPD hours. Like when examining the patient, if an anxious patient comes to me and if I start yawning in front of him because I'm tired, right? So if you're working out, if I wake up at 5 a.m. and if I work out for 2 hours, I go running, I go berserk, this, that, and then in front of patients I'm yawning, I'm sleepy. That doesn't work. That defeats the purpose of fitness.
Exactly.
That defeats the purpose. So
you have to balance out everything.
You have to balance out everything, You can't go crazy every time. I have seen people going crazy, they get injured, and then once you get injured, you're not able to do anything, and then you get demotivated. So the safest thing which I feel to do is strength training. Strength training, and always combine it with cardio.
Listen carefully.
Strength training is the safest thing to do. This is what I feel.
Amazing. One more question I want to add, that what message do you want to give to all the medical professionals who don't do any physical activity, who are not into fitness?
See, I like to tell ki MBBS, what I have done is I have done my MBBS from a government medical college, and after that I have done my post-graduation also from government medical college. The thing is, you have to find time for yourself. You have to do that. That is a must, because ultimately it's your own health. There are many professionals who just ignore their health, and after some time, God forbid, you get some cardiac condition, heart attack or something like that. Age of 35, there are people, doctors, who get heart attack at the age of 35. That is just not done right. So you have been working so hard to pursue your MBBS, your post-graduation, and one fine day, why are you doing this? So that you can help the society, serve the people better.
Very nice.
Okay.
Very nice.
So what I feel is, don't ignore your health, and it's not that difficult. It is possible. There are people who do this. You can, in your free time, you have to work out. Just spare 45 minutes, 3 days a week. Even that is just fine. 3 days a week, working out is fine. Now I am not saying that I am fit. It's not like I am one of the fittest persons. Even I ignore. Everyone has weaknesses.
No one is perfect, and
no one is perfect. Exactly. But you should try your best to be fit. This is what I feel, so that you can educate people better. Now see, if you're counseling people ki yaar you should work out, but looking at say the patient will feel like I don't think this doctor workouts, like he does anything. I think even he follows a sedentary lifestyle. Who is he to advise me? So what you speak, you should practice. There are very good doctors. I know there are many professionals who are doing wonderful in their professional practice, orthopedic surgeons, pediatricians, gynecologists, what not, and they work out every single day. They work out, and that helps them in their practice also.
They will better understand the concept of strength training, because it's quite new. This concept of strength training is quite new. So once they understand the benefit of strength training, they can practice their job better, I guess.
Right.
Yeah.
That is that.